Most people know that basketball is a form of entertainment in the sports industry, but are unaware about how much stress and strain the sport can put on the athlete's body. Over the years, there have been a great number of reported injuries to the body that are related to basketball, even with the advances in science and modern improvements. Today, we'll be counting down the top 5 most common injuries that occur in this profession, all of which can be readily prevented and treated. So let's get started.
Number 5. Finger sprains. A sprained finger occurs when the finger is bent in some way, causing damage to ligaments. Finger sprains often occur by catching or dribbling the ball while someone is trying to steal the ball away. The collateral ligaments or the volar plate may become injured due to hypertension or a strong sideways force. Some signs of finger sprains include pain at the injury site, swelling, or restricted movement. Approximately 320 out of 3,000 injuries reported over a 17-year period were finger sprains, according to a Sports Health Journal study. In order to prevent finger sprains from occurring, a person should tape their fingers to protect their ligaments. Also, when a finger sprain occurs, a trainer can pop a finger back into place or tape it to a stronger finger for more stability and support. Number 4, knee sprains. Because basketball requires strong ballistic movements over a long time period, the stop-and-go movements may cause the menisci of the knee to be at risk. The most common knee injury is an injured medial collateral ligament from an outside blow during the semi-contact sport. Causes of sprains in basketball include running with sudden stops, swift side-to-side movements, and incorrect use of pivoting. A gradual return and brace, along with the continuous use of ice to reduce swelling, should allow players back on the court within a few weeks.
Number 3, groin strains. Since the groin is one of the most used muscle groups in running activities, avulsion fractures and other types can be quite common amongst basketball players due to repeated stress exposure. These fractures occur when force causes a tendon or ligament to tear away when an athlete sprints or changes direction too quickly. Groin strains are characterized into 3 different levels or grades. In grade 1, an athlete may feel some discomfort but still has the ability to walk. In grade 2, an athlete may endure some severe pain, bruising, and even swelling. In final grade, grade 3, an athlete could be facing a complete rupture to the muscle. Depending on the severity of the injury, the athlete may or may not be able to continue to play. Once the injury has taken place, the athlete should start a rehabilitation program consisting of stretching, strengthening, and functional exercises to help treat the injury.
Number 2.
The hamstring allows the knee to bend and the thigh to move backwards. Due to the way the leg comes down on the hard basketball surface, the hamstring is the site of many basketball injuries. More so, injuries occur in teens during growth than amongst adult basketball players. Many cases of injuries occur between an imbalance of the quadriceps and hamstring muscles. Due to the rapid ballistic movements, changes in direction, and contact with other players, the quads may overly tighten and overstretch the hamstrings. As a result, players may experience a certain grade of strain. However, with proper flexibility training and stretching, it is one of the easiest strains to prevent.
Number 1, ankle sprain. At one point or another, almost all basketball players will fall victim to some sort of ankle sprain. In a recent study, nearly 13.2% of basketball players had a lateral ankle sprain of some kind, with no correlation existing between players based on demographics. Ankle sprains are the most common injury compared to all other injuries. Generally, ankle sprains occur when a player steps on another's foot in a game or practice and the ankle turns inward. With an ankle sprain, most ankles are tender or sensitive to the touch, and it generally hurts to move. Ultimately, the more pain and swelling that takes place to the ankle defines the seriousness of the injury, and this also determines the time frame of how long the healing process will take. Ankle sprains can be easily relieved with the RICE method: resting, icing, compressing, and elevating the area using basic flexibility movements.